If you need to directly intervene in a problem situation with a relative, it will probably be because the relative has been dissatisfied with interactions with direct care staff and wishes to speak with a more senior person. When this happens, good idea I think to try and bear these points in mind. The nurse or midwife manager, which is you, should try to be approachable, try to hold your meeting away from the noise and bustle of the ward. You feel at ease there, but the relative probably doesn't. Assess if the patient should be present, but this is not your call. Remember, if the relative and or the patient want the other person to be there, that's their decision. It is not your decision. Ensure that you tell your staff where you are, and this will be a security issue. Just in case something goes wrong, your staff know where you are. If the relative is truculent or loud, have another staff member or a security officer present, but remember that the reason for the truculence or the loudness might just be anxiety or fear or being scared. It doesn't mean that the person is necessarily aggressive, but if they are, try and sit between the relative and the door. Follow the duress and assistance protocols which your hospital has in place. Turn off pagers and mobile phones if possible, and try and sit at the same level as the relative. You don't want to be looking down on them, nor do you want them to be looking down on you. Try to keep a calm and even voice. Don't be strident and don't be defensive. And unfortunately, it is part of the manager's role to absorb anger on behalf of the care team. That's one of the things that you are there for.